This is Dr. Hassan with Kare Chiropractic. Thanks for being here.
Sure.
So we were just going to ask a couple questions today. The first question is, what are some symptoms of low T?
Okay. Great. I'm Dr. Hassan. I've been doing the hormone replacement for at least 15 years. So we hear a lot nowadays about the low T. Everywhere there is a low T clinic and people always talk about what is low T. Low T is a shortcut for low testosterone. As you understand, the testosterone is the main male hormone. We have 90% testosterone. We also have a little bit of female hormone, 10% estrogen. Estrogen is important for our bones and its sex drive. Testosterone is the main male hormone. What it does, it gives us the energy, it gives us the focus, so you can do multiple work and can wrap it up nicely. It gives you more muscle and less fat. It gives you good night's sleep. It increases your sexual appetite. It helps your memory and also get rid of the brain fog. So all of the good things are from testosterone. Now, what are the signs, how you know that you have testosterone deficient? Well, first of all, you might feel tired, fatigue. You are tired, feeling fatigue, but when you go to sleep, you cannot really sleep. Then, of course, your sex drive is less. You're becoming flabby and more like fat, mainly in the middle portion. Your muscle is started shrinking. So these are the common signs. You might also get depressed, forgetful. You also can get you can start any task and not able to finish the task. So all of the signs could be a sign your body is telling you that you may be testosterone deficient. What you do, you come to us, we're going to do some blood work just to make sure it is low or normal or almost normal, whatever it is. So based on the blood work, we kind of decide whether you need treatment or not treatment. Now let's talk about what it does for us. As I mentioned, it gives us the energy, sex drive, all kind of things. And obviously, the medicine is, there is a fewer ways you can take it. There is a gel, there is a cream, there is an intramuscular injection, there is a hormone pellets, there is an intranasal spray. But the most predictive way is only two. One is an injection, intramuscular, one is a pellet. The other I mentioned, the gels, the creams, those are hit or miss. It might work for somebody, it might not work for somebody. So the first step, come to us, you draw the blood, and what are the numbers you're looking, what are you looking for in the blood? You're looking for a certain number. It has a wide range. It has a range from the 300 to 1100. So we are looking for between 900 to 1200 range. We like to keep it there. In that way, you feel much more energized, and all kind of good things from testosterone comes there. If your number is 300, 400, 500, you will not feel anything, nothing actually. So why we get testosterone deficient? That's a good question. And in a single word, I do not know. I'm a physician, I'm not a researcher. By book, our testosterone started releasing in male when we reach our puberty, means like 12, 13 years old. Our voices change, boys' voice change. We started having a little bit of beard and mustache. We get increased interest about the women's body. Those are the times it started releasing. It goes up to 30, and from 30 onwards, it goes downhill 1 to 2%. Now, by book, still we should have enough testosterone till 55 or 60. But in reality, I see my youngest patient in my clinic is 21. And not only one. We have a multiple of 21, 25, 30, 35. So this does not match with the book. So what's going on here? As I say, first I mentioned that I'm not a researcher, I'm not an epidemiologist, I'm a physician, I treat the patient. But it makes me very interested that what's wrong here? We're having a whole generation of low T. There's a lot of factors. You can go online, you can search endocrine disruptor. Mostly number one is the food. We eat the food, processed food obviously, along with multiple chemicals. It has the pesticide, you have the preservatives, you have a lot of hormones, everything. That prevents our testosterone to release. Number two is sleep disruption. Sleep is very important. Sleep is more important than we think. We always think we are Superman, we can sleep only 2 hours and fine. No. Certain hormones like testosterone, growth hormone, they are released in our REM sleep. You have to have a deep sleep. So we are all sleep disrupted. We do not sleep because of stress. And then we also spend times in the social media. So what's the problem there? The problem is you spend some time, maybe 15, 20 minutes in the social media, the blue ray that makes your sleep interrupted for the next 1 hour. That's the problem. And good night sleep is important for all the hormone release. Then comes microplastic. We eat and drink everything in the plastic. Microplastic is so vast now, it is now found in the meat. It's now found in almost all of the produce, all of the food have now microplastic. And microplastic is a huge issue for all of the, not only testosterone, growth hormone, insulin, everything. It's disrupted our whole system. So these are a lot of factors. Maybe there is a lot. There is a go online and see, there is a huge list of the factors, and that can interrupt our testosterone release and cause us to be low testosterone. So how often you need to take testosterone? If it's in the injections, you need to start with once a week. Once a week intramuscular injection. And when you say intramuscular, usually it's a blind injection. You can take in the deltoid. You can take in the upper part of the glute on the side or in the thigh, on the lateral side, outer side of the thigh. It's a straight shot. You draw the needle and in one shot, do not have to do any incline or something, no. Take one shot, okay? If you miss it, make sure you take it in the following day. Plus minus 1 day is okay. Do not miss 2-3 weeks because elastic system, if you miss 1 week, you probably about 50% is gone. If you miss 2 weeks, it's almost 75, and if you miss 3 weeks, it's all gone. Sometimes I get questioned that, Doc, do I have to take this medicine through the rest of your life? In one answer, yes, you have to. You don't have to because this is not a life-threatening medicine, life-saving medicine. It's not something that heart medicine, if you stop it, you're going to die. You're not going to die from the low testosterone. It is more like your lifestyle. So if you want to enjoy the life, you have to have it. But you can stop it anytime. There is no withdrawal effect. There is no withdrawal effect. You can stop it anytime you like. Because once the testosterone is low, if this is your slope, you are on the declining slope of the testosterone. You're here. It will never go up slope. It will always go down, the testosterone. So with the supplement, we can raise it up to a level that you can enjoy life. But as I say, you can stop it anytime. But I can guarantee you, if you start the medicine within few weeks, probably 4 to 6 weeks, you feel the difference. And once you feel the difference, you'll never go back. You're going to keep the medicine as long as you can. What are the side effects? Like any medicine, this medicine also has side effects. There is no medicine in the world without side effects. So number one, if the level goes too high, you become very angry, agitated, edgy, all kind of things. It makes you a totally different animal. You could be a very nice person, but you could be a totally different person when the numbers are high. That's why we check the level every 3 to 4 months. That's number one. Number two, it will increase your prostate size. For every male, the prostate usually start getting enlarged after 40s, but with this medicine, you might see the enlargement earlier. How you can check it? We check something called PSA. If the numbers are under 4, you're fine. If numbers are more than 4, we stop the medicine and we send you to urologist. Other questions. Sometimes people ask me, is there any risk of cancer? That was a question for the long time. There is a two group. One group says it can cause cancer. One group says it doesn't cause cancer. Now we are for sure it does not cause cancer. Now, if you develop prostate cancer just by itself, as you can have any cancer anytime, it may make it aggravated. It can make it spread faster. So that's why we check the PSA. If the PSA is within limit, you're safe. If PSA is higher, we hold the medicine, we send it to urologist for further checkup. What are the other side effects? Number three, it makes the blood thick. Our usually blood count is between 14 and 15. Up to 16 and 17 is okay. More blood means more oxygen, you feel better. But when it becomes 18 and above, the blood becomes too thick. It becomes too thick to circulate. And that's the time you feel like dizziness, headache, double vision, all kind of things. If it becomes more than 20, your hemoglobin, which is usually 14 or 15, you can have a risk of a stroke. So if your blood count becomes 17 or above, we will ask you to go for blood donation. Very easy fix. Do I have to do it every month? No. You might have to do it once or twice a year. That's only 15 to 20% patient. It's not for everybody. It's not like mandatory everybody has to go to for donate blood. 10 to 15% patient might feel these things. Other side effects, it can increase your female hormone. I mentioned you before, we have 10% estrogen. Now, your estrogen number can go up. So what's bad on that? If it goes too high, usually more than 40 or 50, more than 50, I would say, then it's going to work against your testosterone. Your testosterone level could be 1200, but you don't feel any difference. You feel still flabby, tired, exhausted, because your estrogen is blocking the effect of the testosterone. So in order to prevent that, we also give you estrogen blocker called anastrozole. You take it only once a week to keep your estrogen within the limit. These are in more or less in a nutshell of the testosterone. Now there is one more thing. Testosterone can reduce the sperm count. This is a reversible side effect. That means anytime you stop the testosterone, your sperm count should go up. Still, if there's a younger folks who wants more kids, they're interested in the testosterone, I will always start them on something called enclomiphene or clomiphene. These are the medicine you take once a day, and that will increase your sperm count or maintain your sperm count so you don't have a problem. Most of the times, whenever you want to have a kid or baby, you let us know at least 6 months before time. So we lower your testosterone level, we maintain or continue your enclomiphene, and almost all the time you can be successful to be a father. In a nutshell, I think that's pretty much all of the testosterone. If you have further questions, you can always ask your fondest, beautiful person, Danny, or you can just reach out to me. Okay? Have a nice day, everybody.